Good afternoon, everybody. Welcome to our media update, our question and answer session that we try and do once a week for the media, answering your questions as well as questions that others in the community have. We will again today walk through our regular process of the state data, the local data, some of the updates at a state and local level, and then we'll answer media questions that have come in advance, as well as any that come through the chat box, or at the end, Audrey will help me by monitoring whether or not we have anybody that wants to ask a question out loud at the end. Today is Wednesday, November 25th. Again, thanks for joining us. This is a different day than usual, with tomorrow being Thanksgiving. We moved to today, and we were glad that people were able to make it and join us for today's time. Happy Thanksgiving early. Tomorrow is a day that many of us get together with friends and family and pause to be thankful. It's a day of celebration. For many people, it's a day where they're off their regularly scheduled work situation and can take a pause. It'll be different this year. It's going to be different for all of us. And our ask in public health is that we make a significant change in how we celebrate Thanksgiving this year to keep each other safe. We need to protect ourselves, but also protect those people around us. I will miss my extended family this year. My brother, who is an awesome cook, typically comes to Eau Claire from Milwaukee and makes a turkey for all of us. It's better that he's not traveling, that we are not all gathering at my mother's house with my extended family. I will miss that family, and we'll get together via phone call on Thanksgiving and connect with one another. It's hard, but it is better. I also am one of those lucky people that have had for many years now a turkey made for me by my brother, who loves to cook. So I will have to be creative this year and make a turkey with just my family. So we'll be learning something new this year. I challenge all of you to find something to be challenged by with Thanksgiving, but in a good way. Find something positive to make of the differences that we will be all experiencing. I'll be reminding myself of how you actually get a turkey in the oven and have it ready to eat by family. I also want to make sure that with us entering into Thanksgiving tomorrow, that we don't walk into tomorrow's celebration thinking that a test that was done earlier in the week this week or last week, if people chose to get COVID-19 tested, that they think they have a free pass to do what they want the rest of this weekend. That is not the case. A negative COVID-19 test is useful information, but it's not sufficient information to entirely change what you do this weekend. A negative test today doesn't mean that you will have a negative test tomorrow or the next day. Having everybody quarantine the 14 days before this celebration or any other celebration is an enormously helpful thing to do. But if you are not able to completely quarantine for the 14 days prior to the Thanksgiving holiday this weekend, you need to make sure you keep distance, and you need to make sure that you keep a mask on to protect those around you. We'll walk through the state data to start with, then the local data, and again, go through some of those updates. At a state level, we now have 2,116,549 negative tests that have been done in Wisconsin since the start of the COVID-19 pandemic. We have 369,442 individuals that have tested positive that are Eau Claire County residents, an increase of almost 31,000 people in Wisconsin that have tested positive in the last week, less than a week ago Thursday. Hospitalized individuals now are at 16,457 Wisconsin residents that have ever been hospitalized with COVID-19, an increase of 1,121 people since last week, Thursday. And we now have 3,178 Wisconsin residents, our family, friends, neighbors, coworkers, who have died related to COVID-19. That's an increase of 302 people since just last week, Thursday. Again, a total death since the start of the pandemic in March of more than 3,000 Wisconsin residents. In comparison, just to note that last year during our flu season, which again is typically October through March, we're entering the flu or the respiratory disease season. We had 183 people that died tragically from the flu last year. 183 people died of the flu. We now already, before we get into the respiratory season, have, as I said, more than 3,000 people in Wisconsin that have died from COVID-19. Unfortunately, we've set another record at a state level this week for newly reported deaths in a single day. That was yesterday on the 24th. 104 individuals were reported to have died related to COVID-19. The 7-day positivity rate by people tested is at 28.3%. The positivity rate by test at a state level is 13% as of yesterday. Again, much higher positivity rates than we are really having as a goal for the state as a whole. In Eau Claire, we now have 37,323 negative tests for COVID-19. Our number of people in Eau Claire that are Eau Claire County residents that have tested positive is now at 7,479, an increase of 701 people since last week, Thursday, that have tested positive. We are averaging about 116 cases a day in the past 6 days for positive cases of COVID-19. The positivity rate by person is 37% for Eau Claire, which is higher than the state rate, which I just shared with you was 28%. And that remains extremely concerning. 72% of the people that have tested positive for COVID-19 in Eau Claire have now recovered. It does mean that we have 1,971 individuals in Eau Claire County right now that are staying home isolated and whose close contacts are staying home quarantined. Again, when you think about the volume of people in Eau Claire that are impacted by COVID-19 today, it is significant and certainly an enormous volume over the last number of months. We're actively working with those individuals to make sure that they have the information they need to be isolated. We are counting on people if they get a positive COVID-19 test to stay home. Staying home means you do not go to work, you do not have people visiting you, you do not travel. You stay home. You make sure that you are not spreading COVID-19 to other people. The same with those that are close contacts. If you were identified as a close contact to a positive case, again, what we need people to do is stay home 14 days following the last time you were in contact with that person that is a positive case. The reason for that 14-day quarantine is important. We need to slow the spread of COVID-19. Those people that were close contacts are the ones most likely to be the next group that gets COVID-19. Those close contacts, if they stay home, it means they're not potentially spreading COVID-19 to people when they don't realize that they are infectious. It's a critically important strategy that we have in Eau Claire that we need people to follow. Of the individuals that have been positive in Eau Claire County, we've had 237 people that have ever been hospitalized, 34 more people in Eau Claire since last week, Thursday. We now have 56 of our Eau Claire County friends, family, neighbors that have died from COVID-19, an increase of 8 people since last week, Thursday, when we last shared with you. Regionally, there are 204 individuals that are COVID positive in our hospitals within the region. The majority of those are people that are in Eau Claire-based hospitals. Those are not all Eau Claire County residents. Those are people from across the area that are hospitalized. But do know that we have, again, friends, family, neighbors that work in those hospitals that are supporting people that are COVID positive and that need hospitalized care. And we need to support those people in keeping the numbers as low as possible. With a regional medical system here, healthcare system here, it's important that we not have that system be overwhelmed. Nearly 4 out of the 5 COVID-related deaths in our county have happened in the last 30 days. It is a measure to show us that our increasing number of cases and our increased hospitalization is directly related to our increased deaths in the community. Public health investigations listed on the state website, we're now at 54 active investigations. Those are a mixture of long-term care facilities where there are 22 active investigations, educational facilities, group housing, workplaces, and other settings in our community. In all those situations, we are actively working to support slowing the spread of COVID-19 in those settings. The state rating for COVID-19 activity level in Eau Claire County remains at critically high. This is really a reflection of our high case numbers and the trajectory of cases, or the direction that our cases are going. Again, the last couple of days, we've thankfully seen not increase in case numbers, which is good news, but we still are at that over 100 cases a day on average in the last week. And that really is at that exceptionally high level. Critically high means a little over 1,000 cases in 2 weeks. And we've had more than 1,000 cases in the last 8 days. So really, our goal is to be significantly below that. Our first 1,000 cases, just for perspective, took about 6 months to happen in this community. Disease spread was slow then, and we need to slow things down again. Every week we report on jail testing, and as of Monday, 250 individuals have been tested connected to the Eau Claire County Jail. 19 of those individuals have been positive, and 18 of them have recovered. Cases affiliated with UW Eau Claire since the beginning of the school year are at about 18% of all our cases. We continue to work closely with UW Eau Claire on their testing and their follow-up in order to make sure that people that are connected to UW Eau Claire, faculty, staff, and students, are supported in preventing the spread of disease. UW Eau Claire has been a wonderful partner additionally in sharing the antigen testing capacity that they have with the community, and that testing site will remain in place at Memorial High School. You can find out more information about that on our website. We anticipate that being around for a few more weeks. A reminder to everyone that in Eau Claire County, we have cases across all jurisdictions. In every part of our county, we have positive cases of COVID-19, and in every age group. It's important to remember that for all of us, that it is not isolated in a specific area nor with a specific population. This week, Governor Evers reminded everybody to think about mental health, their own mental health and others' mental health. This is a topic that we often bring forward this time of year as holidays happen. It can be particularly hard for many people that may be challenged with connections to others during holiday seasons. It couldn't be more important this year than it has been every other year to make sure we're paying attention to our own mental health and the mental health of those around us. It doesn't take much to reach out and make a phone call or do a Zoom call if you can to people that are isolated, alone, that are struggling. I encourage those of you that yourselves are struggling to reach out, find that person that you can be connected with to talk through where you're at and to make a connection. For those that need it, there are additional resources also available. Texting the Hope line at 741-741 is a resource for free emotional support if that's needed. The National Suicide Prevention Lifeline at 800-273-8255 is also a resource, or calling 211 and talking to someone there about resources that you may need are all potential. I also think each and every one of us, though, can reach out to someone over this Thanksgiving weekend. Be thankful for the connections we have and make use of them. Make sure that you are sharing with others that you are thinking about them and that they're important to you. We need this now more than ever. I also encourage people for their mental health to get outside, get some sunshine. Vitamin D does us all good. There is also some growing evidence that vitamin D may be one of those things that helps all of us in facing a COVID-19 infection. We'll learn more, I'm sure, about things like that as time goes on, but vitamin D and outside exercise is always good for our bodies. And the stronger we are, the more likely we are to be able to fight off any infection, whether it's COVID-19, influenza, or even just the common cold. So again, this weekend, get outside, move, get some sunshine if you can. I'm hoping for sunshine this weekend. We also want to share that we have updated our Respond Together Eau Claire plan. That first plan was released back in July of 2020. It was our way of really sharing with the community what the data would be, what data we would use to inform how our order at the time was moved forward through different stages. We had explicitly laid out in that document the stages that we would move through as data informed that practice and as evidence changed about the disease. In that document, we really walk through the metrics that we've been tracking every week to share with the community about what's been happening. Today, we released an update to that Respond Together plan. That update is on our community expectations page on the website. You can click on the link there, and you'll see the 8-page document that is our Respond Together plan for how we are really signaling we need to continue to move forward together in responding to this disease. The Respond Together plan, which has the metrics and what we are following for data, along with our local expectations document, as well as state orders, state advisories, and the orders and advisories that we are getting from various industry partners, really frame what we should be looking at in this community at an individual level, as well as at a business and community partner level. We talk in that document about mitigation strategies, and that may be a daunting term to some people, but mitigation strategies are those things that we can do to decrease the impact of a disease in our community or of a problem in our community. Mitigation strategies for COVID-19 are those things that we can do all the time with COVID, and we have standard mitigation strategies that are listed in the document, like keeping 6 feet distance and wearing a cloth face covering. We expect these things to be in place for really all of the time until we have an effective vaccine that is given to enough people in this community that we have herd immunity. We expect those things to likely be in place as mitigation strategies that we need to keep solid during this COVID-19 pandemic. We also list out mitigation strategies, things that we all can be doing that are connected to things like our expectation document when disease rates go up and hopefully come back down. So for example, right now, the mitigation strategy of keeping our group size at 10 or smaller beyond our household is really a specific mitigation strategy that is connected to our metrics that are in the Respond Together plan. Our metrics don't look good, we need to keep our group sizes smaller. If our disease incidence changes, if the amount of disease that we have in the community improves, if our hospital capacity and our public health capacity improve, we can expect that a mitigation strategy, like how many people we can gather with, will change. We will increase that number in our expectations document. That's how those two work together. Those layers of mitigation strategy are really what we all need to think about. At an individual level, what do I do to make sure that I'm staying safe and I'm keeping my family and household safe? And at a business or a community site level, we can all lean in and work harder on this. The document does continue to be a guide for everyone, individuals, businesses, schools, religious organizations, community partners broadly, government, to really utilize, and we expect them to be utilizing that. The expectations document continues to be the guidepost when we reach out related to complaints. If we get a complaint on an entity, we do follow up. We follow up with a phone call. If needed, we follow up with a visit. And we document those complaints and the challenges that an organization may have with what we are seeing they're doing related to following the expectations document. We need to call everybody in to following those expectations. We need all of us to be doing this together. It can't just be some of us. We will not have success then. Typically, during our briefings, we share our updated metrics, those once a week measures that I just spoke about in our from our Respond Together plan. Because it's Wednesday, we don't yet have those metrics. They will be available later in the day tomorrow for people to go to the website and look at those. We do know that testing has been generally steady, but a bit lower this week, so we expect that to be down a bit. We also know that our ability to do disease investigation and contact tracing continues to be challenged. Our team continues to follow up on cases that are identified right now as high risk, which are those that are under the age of 18 and those that are 65 and older. Others, again, may not be getting a phone call from the health department. If you're a case, we expect you to go to the website, look at that face page of the website to identify what you should be doing as a positive case of COVID-19 and what those close contacts that you have should be doing. Certainly, you can call the call center number at 715-831-7425 if you have questions about that. Again, that final reminder that it's Thanksgiving tomorrow. We need people to have smaller groups. We need people to really pay attention to slowing the spread. We also know that this week traditionally includes not only deer hunting continuing, but also traditions around Black Friday and Small Business Saturday and continued family celebrations. Again, all of those events can and should look differently this year. So not just your Thanksgiving turkey meal, but also all of the rest of the events that some families really hold as important traditions. We need this year for things to look different. I would encourage all of you to really think about how you're supporting the community in the choices that you make this weekend, especially related to those that are privileged enough to be able to do shopping in advance of the Christmas holiday or the winter holidays ahead of us. If you have the ability to do that, think about using your dollars in a way that really speaks to how you support this community's efforts in slowing the spread of COVID-19. Go to our small businesses, spend money at places where they are working hard to follow the expectations document and keep spread slow, where you are visibly seeing action happening to support the community. I really encourage you to take time to really support those places that are making a difference in this community, especially given COVID-19. It's hard on small businesses. It's hard on all of our businesses right now. Really make sure that you are supporting those that are doing the right thing to keep spread slow. The slower the disease spread, the quicker we will be back to life as a bit more normal in this community. I will now move to some of the questions that we got in advance, and I'll ask Audrey, who's not in the space with me, so that I can talk to you without wearing a mask on, but who I know is monitoring the question and answer chat box, but also will be available to work with you if you want to ask questions in a minute to be monitoring that. So the first question is, do you expect a spike in COVID-19 cases after Thanksgiving? If so, how are you planning for that? Certainly after this weekend, which will likely include people gathering related to deer hunting and Thanksgiving, all of those activities that people may have chosen to do. It's hard to predict what we will see in increased cases. It's really up to all of us and what we are choosing to do in the next several days to see what happens with increased case numbers. We obviously will be watching that carefully over the next, the 14 days following Thanksgiving will be a critical time for us to watch. Similarly, after other holidays that will be happening in the next several months. It is dependent on our choices. We are already at an exceptionally high level of cases. We, frankly, can't afford to increase the case numbers. We can't afford to put us in a situation where we can't follow up on all the cases, and we have increased hospitalizations. So again, we're counting on the community to really make a difference in slowing the spread. We also know that the spike in cases may mean that we need extra capacity. So do know that we are staffing over this weekend, but are continuing to grow our staff to follow up on cases over the next number of weeks. So we continue to work through that as a health department and as an incident command team to bring people on board to do that disease investigation work. And we are really working daily on making sure that we have the capacity that meets the need in this community. You'll help us by decreasing the need. Second question is related to planning around deaths. Earlier this month, officials from Marathon County Emergency Management said that they were bringing together a mobile morgue, preparing for the potential that they would need something like that. Again, that report was they were hoping for the best, but preparing in case they needed that kind of capacity. Certainly in Eau Claire County, it is not something that we want to have to be working on, but we are, as we have for many years, we have a mortuary plan for disasters. This is a time and a place where that mortuary plan may be put into effect. We work closely with our healthcare providers and our medical examiner, who would be point in working through when and if something like that would be needed. We right now are in a good place in our community with being able to be responsive, but we are certainly in regular communication with those partners and are ready to be responsive if we need that. Again, we're counting on the community to work with us so that that's not necessary. And then I believe the final question is related to the expectation of vaccination, that there was some communication that we might know already when we are receiving vaccination. I have not gotten confirmation about when vaccine will be available in Eau Claire, and it is my understanding that the state does not have a firm date yet. What has been worked on across the state, and this is being done by the state vaccination leadership group, is identification of locations where vaccine can be distributed from. As I've shared earlier, that this vaccine that we know will be available for the first round of vaccination for our healthcare workers primarily, that vaccine is required to be in very, very cold storage. And there are only certain places that can really house that kind of volume of vaccine in cold storage. So we do know that likely we will be a hub for some of the vaccine in Eau Claire County at a couple of the facilities that have that kind of very cold storage available. But we don't know when it's arriving, and we certainly do not yet have dates related to actual vaccine distribution. We will be very transparent about that when we know when vaccine is available. Again, it will be a tiered approach. We don't expect vaccine to be available to the general public for quite some time, unfortunately. It will take a while for production of a safe and effective vaccine to be available at the volume needed to vaccinate all residents in Eau Claire County, as well as every place across the nation. So it'll take time. We are working with the state and with our healthcare providers on how that moves forward in our community in an efficient and effective way. And we will keep people informed about that. So I will ask Audrey to share with me if there are any questions in the chat box.
Yeah, we have a question from one of our media partners who's asking if you can speak to the fewer number of tests recently, and do you know why testing in the county might be down this week compared to previous weeks?
Yeah, thanks for that question. So a specific question about the volume of testing being done in the county and why it may be down a bit. We did, in our incident command briefing this morning with all of our healthcare partners, hear from them as well that they are seeing slightly lower testing levels in the last few days. The general sense is that people may last week have gotten tested again in advance of hunting and the Thanksgiving holiday. Again, the message is that getting a test does not mean you are free of COVID-19 now, days later or a week later, but we do know some people chose to get tested last week and that increased our volume then. It's a bit down from there. We are investigating whether or not, because we also saw some low positive numbers at the beginning of this week, whether or not there are any specific concerns related to our state data system, and they are checking that for us. But at this point, we don't have any specific concerns. We know that this week for some is a week where people do take a break, and it may be one of the reasons that individuals are not getting tested. We do remind everybody that if you have any symptoms and if you are a close contact of someone that is a case, we want you to get tested. There are testing sites available. There is space in those testing sites. On our COVID-19 website at the testing tab, there is a full calendar of test locations available. Some of those are not operational tomorrow on Thanksgiving, but there is testing available all week and all weekend. So please, if you need a test, please get a test. We need that information so that, again, we can make sure people are isolated and quarantined as necessary. Are there any other questions in the chat box?
That's the only chat box question. So if any of the media partners would like to unmute and ask a question directly, please feel free.
All right. Thank you, everybody. To the media partners on the call, I hope all of you have a wonderful Thanksgiving. And to everybody in Eau Claire, I hope you find time to be thankful for all of the wonderful blessings that we do have in this community and across the county. I also would remind you that you can go to our website to get up-to-date and current information, covid19eauclaire.org. And call the call center if you do have specific questions. Leave a message there on Thanksgiving tomorrow. Nobody will be answering, but we will be back Friday and through the weekend with urgent issues being available for you for that and for follow-up phone calls. Next week, our briefing will be on Thursday, December 3rd, as usual. So we look forward to talking to you then. Happy Thanksgiving, everyone.